A hearty good afternoon and welcome to the session on cryopreservation for girls with Turner syndrome. We are glad to have Dr. Swati Shree among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. Hello, all. So, today we'll be discussing on cryopreservation in girls with Turner syndrome. So, I have a small presentation. How can you present? Yeah. Okay. So first of all, what is Turner syndrome? Many people might not be knowing what is Turner syndrome. So Turner syndrome is a chromosomal disorder that affects only females. So it is basically chromosomal disorder means the things which are in the genes. So chromosomes are the things which are present in each of our cells, and they are the basically the ones which are carrying the genetic material. So it occurs when the female is born only with one copy of the X chromosome instead of typical two copies. So see, there are actually 46 chromosomes in a human being. So every cell of a human being will be having 46 chromosomes. In males, it will be 44 plus X and Y. In females, it will be 44 plus XX. So what happens in females with Turner syndrome? Here you can see that X is only one. There should be other X should be there, which is missing. There is also sometimes Turner mosaic in which half of the cells of their cells will be having the normal chromosomes will be there in half of the cells, whereas in half there will not be. So this is called Turner mosaic. So any of the chromosomal abnormalities can be present, and sometimes it can be like they have the normal chromosomes, but there might be some defect in one of the X chromosome. So that also leads to Turner syndrome. So why it is important to know about the Turner syndrome? What it is impact? So it has a varied impact actually, and we need to know about these impacts. And some of the people who are suffering, they have need treatment and help. So this what how does this affect of individuals? So if there is Turner syndrome, this can lead to a variety of physical and developmental abnormalities, including short stature, ovarian dysfunction, and certain characteristics of face and neck. Some people with Turner syndrome may also have heart and kidney or hearing problems. So there can be multiple abnormalities can be there. There cannot be can be some abnormalities. So every individual will be having different abnormalities because every individual will be having different effect. So coming to the apart from the whatever are the abnormalities, today we are here to discuss about the fertility aspects. So first of all, I would like to discuss about the effect on the reproductive system. So this X chromosome, which is either defective or is not present, so what does it has effect on the reproductive system of that female? So ovarian dysfunction, it means that ovaries will not be functioning properly. So ovarian, the what happens, the ovaries which produce eggs and hormones in female may be underdeveloped or not functioning in women with or in females with Turner syndrome. Other effect it has on the sexual secondary sexual characteristics. So there may be either not properly developed or underdeveloped secondary sexual characteristics can be there, like such as breast development. And other effect on Turner syndrome because of the reproductive system effect is like the timing of the puberty. Some may not be able to attain the puberty. Some it may be delayed. Puberty may be delayed. So these are the effects of Turner syndrome on the reproductive system. And when these all are affected, when they are affecting the ovaries, when they are affecting the sexual characteristic development, they also have effect on the uterus. So these when these effects are there, overall most of the women girls with Turner syndrome are having infertility issues. So but some of them can have spontaneous birth and childbirth. So it has a great impact on the fertility of the females. However, with the help of replacement therapies and assisted reproductive technologies, some individuals with Turner may be able to conceive a child. So, what are those methods? What things we can have for those girls? We have to see. So, it is very important to note that every individual with Turner syndrome is unique and will have a different set of symptoms and experiences. So one more important aspects comes in the internal syndrome. Like they might be thinking that does it affect? Is there any inheritance? So have they got this from their parents, or are they if they are like if they we are telling them up for the fertility preservation, we are telling them about the various options for pregnancies. So this is one of the question which many people have, which they people have, like if they are affected with Turner syndrome, will their baby will also be affected? Most of the cases of Turner syndrome are not inherited. Mosaic cases in which some of the cells are normal and some of the cells are not normal. So in those cases, some also it's not inherited. Rarely there are some cases of the Turner syndrome females in which the both the X chromosomes are there, but one of the X chromosome will have little abnormalities. Those cases might be little bit chances of inheritance is there, but they are very rarely it happens. Now coming to what are the fertility options. So as we have seen, spontaneous pregnancy is possible many times when women have a good ovarian reserve. The abnormality is not too much. So the abnormality of the X chromosome, which is not there, can range from various from very minimal to a very great changes. So some people might have a very limited effect. Some people, some females might have very high effect. So if those who are not having too much of the effect, they may have spontaneous pregnancy. So spontaneous pregnancy has been seen in the woman with Turner syndrome. So and the spontaneous pregnancy has been seen more in the women who are having mosaic Turner. That means those having some of the normal cells and some of the abnormal cells. Also the it has been seen more in the woman who has partial problem of the X chromosomes. Other options are like if we are offering fertility preservation, and also there is also the options of there if everything fails, then the other option is for of oocyte cryopreservation is there, oocyte donation is there. Like if they are not able to have their own eggs, if we are not able, oocyte donation means egg donation. So if they are not having their own eggs, in that case from the healthy donor we can take the eggs, and that can be used for the pregnancy, and they can have their own pregnancy with the egg donation. Other is like as a last resort comes the adoption. A recent study has showed that an overall 5.6% prevalence of spontaneous pregnancies in women with Turner syndrome has been found. Most of these pregnancies occurred in women with mosaic Turner and mosaic Turner syndrome, and only 0.4% of the pregnancies were in women with rare mosaic exo syndrome. So we can see that, as I had told, that spontaneous pregnancy is possible. It's not impossible, but it's more in the mosaic. So, what exactly happens, and how the spontaneous pregnancy is possible in some, and how it is not possible in some? So, actually, they have the ovaries, they have the follicles, but what happens because of some genetic defect, there is accelerated follicular atresia. So, what does that mean? Follicular atresia means that they become dead, or they become degenerated. So, there is very high. So follicular atresia or follicular degeneration is a normal process which happens in every females. That, and this is the reason why with age, with time, all the females fertility goes down, because it's a continuous natural process. But in females with Turner syndrome, what happens? This is accelerated. That means it is very fast, and it starts very early in their age. So many a times, if the puberty has attained, once puberty is attained, the females have this degeneration of the follicles or the eggs is very fast, and they will go into menopause also very early. So, due to accelerated follicular atresia seen in these women or girls, the majority of the adolescent girls undergo ovarian failure prior to or around the time of the puberty. So many a times, if they are with the very fast degeneration of their eggs, if they might get exhausted of total of their eggs before, even before of the puberty. So in that condition they might not get the puberty event. So it all depends upon how the egg is degenerating in them. Traditionally, donor oocyte conception has been predominant fertility option for such patients. So initially, when there was no fertility preservation, when there was not such a good options of cryopreservation, like freezing techniques were not there in that time, when IVF had come initially, then initially the donor oocyte conception was prominent. That means the egg was taken from some healthy woman, and that can be mixed with a partner of that woman, and that can be made embryo, and that can be transferred to that woman with Turner syndrome. So that is, she can have her own child, but it will not be biological. She can get the pregnancy, can have the delivery, but that oocyte or egg is from the donor. So that was one of the options, which was the only option which could have been what was given till few back years back. But what we have now, now it is time to consider ovarian tissue cryopreservation for girls with Turner syndrome. What is ovarian tissue cryopreservation? So actually, ovarian tissue cryopreservation is like when they are, just I told that there is very high rate of degeneration of the follicles or eggs in these girls. Many a times even they don't reach the puberty. Before reaching puberty, they have all the eggs being exhausted. So and they do not reach the puberty. So if we are knowing that from the before, like immediately after birth or in very early age, if we are knowing that female is having Turner syndrome, in that females or in those girls, we can do ovarian tissue cryopreservation. That means we can take out the ovaries and freeze it and use it later when she wants to conceive. Another option is oocyte cryopreservation and embryo cryopreservation. Generally, these options are there when there is woman and when the girl has attained the puberty, and she has started eggs to be matured. So in every girl, every month, few eggs, one egg gets matured, and then that goes for ovulation and fertilization happens, and that leads to pregnancy normally. In IVF, what we do is we hyperstimulate the eggs. We give injections so that lots of eggs are there, and we take it out and we mix it that with the husband's or partner's sperms, and then the pregnancy happens. So in these, if they are very young, like since there is accelerated degeneration, we are knowing many girls have attained the puberty. So some there is some window of period when we have time. So in that window period, we can take out the eggs and we can preserve that. Embryo cryopreservation option is there when there is like they have the partner and then they want to have embryo cryopreservation, that can be done. So these are the three fertility preservation options. So there has been, after lots of studies and many trials, and there is some pro forma which has been there, guidelines has been given about the fertility preservation in girls with Turner syndrome. Accordingly, we have to see that they are pre-pubertal or pubertal. So, suppose they are pre-pubertal, then we have to see for the mosaic or they are non-mosaic. And also we have to see that if they have good ovarian reserve. So ovarian reserve markers, like in any other woman, the ovarian reserve markers which are commonly used are FSH, AMH, and antral follicular count. But this is not the only thing which we have to take in consideration. We have to take in consideration other things like the other risk factors, if they are having any heart disease, any other problems. So those all considerations has to be taken. So if those women having mosaic, there is generally a good chance of having follicular recovery at an adolescent. So in that woman, we can wait for ovarian tissue cryopreservation, and in those women we can do oocyte cryopreservation. For those who are non-mosaic, they have a rapid, very high rate of degeneration of the eggs. So in that woman, ovarian tissue cryopreservation is considered to be the best option. But coming to ovarian tissue cryopreservation, there are too much of the dilemmas associated with ovarian tissue cryopreservation. What are the dilemmas? First is that age. Since we are taking out the ovarian tissue, what is the most appropriate age to do this procedure? Because we don't know at what time they start degenerating the eggs. So if they are mosaic or those with having very structural problems in the X chromosome, we can wait. It has been found that till 17 years of age, they have the reserve. But those who are pure XO, like females, they have their degeneration starts very early. So age is a very crucial thing which has to be taken into, which is one of the dilemma, that what age, and at such a small age we are putting the girls for the surgery. Another is amount of the ovarian tissue, which what has to be taken, how much ovaries should be removed. So many theories have been proposed. So one of that which has been proposed is, like, we can take out one side ovary and we can leave the other ovary. Other is like, we have to take only partial, only one of the part of the ovaries. So this has to be decided. And we are talking about the girls who has not yet attained puberty or is about just attained the puberty. So this is a very tender age. So most of the things which we are discussing, we are not discussing with the girls themselves, and we are discussing with the parents. And so this is a great dilemma for everyone. It is also a psychological dilemma, because the girls who are at this tender age, who should be with their peer group in the school, in the colleges, they are stuck with something else. They are thinking, they have, so they do not have very good self esteem also, and these all have psychological impact on them. Another ethical dilemma is that, when having a childbirth or decision for a childbirth is any individual's own right, but at this place, it's right, this right has, or this decision is being taken by parents, because this is something which child cannot think at that age. So this is one of the ethical dilemma, because, and basically this procedure is, when we are doing this procedure, it is basically done on the concept of in the best interest of the child. So when the parents, when the care provider, if all are agreeing, then it is okay. But if there is some conflict in the thoughts, then it produces an ethical dilemma. So these are some of the dilemmas. And also with the ovarian tissue cryopreservation, there are some studies, there are some cases where when the ovarian tissue was removed and transplanted back to the girls when they wanted pregnancy, they had some pregnancy. But yet the studies are mostly on the cancer patients, which who are generally in adults, and not these girls who are very at very tender age, and in whom the ovaries might not have just attained the maturity also. So this is one of the dilemmas which are there associated with ovarian tissue cryopreservation in girls with Turner syndrome. So it is very important to note that fertility preservation is not always possible, and the success rate depends on the individual's case. So it is very important to individualize each case. Every case is unique, and every case has to be seen individually. And we have to, or not only think about the fertility preservation, we also have to think about, because with Turner syndrome there are other abnormalities, there are heart problems, there will be other hormonal problems, diabetes, thyroid disorders, many other problems will be there. So individually we have to see how fit that girl is, and will that girl be enough fit for to carry over the pregnancy. So these are all the circumstances, and if depending upon each and every circumstances, we have to take a decision. So it is overall a decision by a team. It's not by decision by a one person, or any one step is involved. So additionally, some methods may not be suitable for everyone. The best option will depend on individual's age, medical history, and specific circumstances. So it is recommended that individuals with Turner syndrome consult with specialists in reproductive medicine and genetics early on to discuss the best fertility preservation options for them, because options are there, and everyone might not be fit for every treatment, but some treatment might fit for some. So it's very important to have the treatment early, to at least take a consultation early, discuss, see for your options, so that in future you have the options. So that's what I will say in the end. Thank you.